Hi everyone, and welcome back to the Diary of an Endodontist. And before I start my next treatment today, I'm going to show you how our trays are set up for our treatments. So basically, we have two sets of trays. One is the first tray that goes in the patient's chair, and the second one is the nurse tray. So in the patient's tray, we've got few things: the fast handpiece, slow handpiece, and then we have, I've put on the side because I was putting on the chair, the ultrasonic as well. That helps a lot when you are doing your access cavity. You have lots of things inside of your cavity, so it's always good to use that. It's very handy with a long tip, and you can flush that out, and it's easier for you to locate the canals. Two sets of mirrors, because we use four-handed endo. So when I'm working with that mirror gets dirty, assign that to my dental nurse. She puts the other one on my hand and grabs this one, so that doesn't delay my treatment. DG16, which is the probe where you have the end, straight end probe, both sides. A normal probe with the perio end and the curly probe. Flat plastic for your composite work afterwards. Ball burnisher for your composite work as well. And the endo ruler, I quite like that. I say that is my wedding ring with my dental nurse. So I always keep that. Although all my dental nurses, they are trained to do the working length and to set all the files for me. If I have any doubt, or if I'm checking the working length myself, I always use my double check ruler. So it's always good to have that. And there is as well the burr stand, where I always have the enhance to help me with the polishing. I've got here the transmetal burr if I'm accessing the crowns, and a normal access burr. And there are two long neck burrs, one very thin, 0.6, and the other one 10. So always have the two as well. In case you want to use diamond, attach it to the ultrasonic, is possible as well. So we have the satellite, and we attach to it on my side over there. And that is the tray for the patient. The other tray is the tray that stays with the dental nurse. So we've got gauze, and we've got the endo ring, which goes in my dental nurse's finger, where she has the ruler and the bar stand, the file stand. I stand where she can measure and calibrate all my GP points and paper points, which is very useful as well and handy. Pair of scissors, the rubber dam kit with the forceps, and then I'll choose the clamp according to my patient. Plugger for the warm vertical single cone, or whatever we are using. We always need the Buchanan plugger. And that is important. All of our tweezers are locking tweezers, and I tend to set in the trays like at least 4, and that's for the molar, isn't it? Because we've got 4, and an extra one because when I'm doing paper points, I need at least 2 locking tweezers for the paper point exchange. So basically that's it. I hope you enjoy it, and let me go back to my treatment. See you next time.